Well, I'm here for my epilepsy. Eventually, I would like to be seizure-free or on less medication, and it's just to start a new journey in my life and maybe one day have a family.
So Stephanie is extremely sweet patient. She started having seizure when she was 8 years old. And what's really unique about Stephanie is that her seizures were happening every day. And you know what really broke my heart when I heard the story of Stephanie is that all her dream is when she graduates and have her life is that she wants to have family, she wants to have kids. And with the medication that she was on, I was extremely concerned about her health and the health of her family or health of her kids. In the past, in order to define where the seizure is coming from, we had only one option, and this option was to remove the skin, open the bone, and expose the brain. And then once we exposed the brain, we were putting a lot of plastic wires and leads throughout the brain in order to define where the seizure is coming from. One of the major limitations of the old fashion of doing the surgery is we had to stick with the surface of the brain. We were not able to get any information from deep inside the brain. And also we had very limited exposure, so we were not able to cover a large area of the brain. What's unique about the ROSA, which I think is what's helping us to understand more and provide more treatment options for our patients, is now we can provide a larger sampling of the brain tissue, so we will be able to cover multiple areas and put multiple leads in different locations in order to define exactly where the seizure is coming from. And what the best part of this is it comes in a very non-invasive way. So there is no exposure of the brain, there is no removal of the bone flap. What we do is Dr. Damasi does small bare holes and we place those electrodes after a lot of calculations that we do before the procedure. We know exactly where the target will be, where the entry point will be, in a very non-invasive or minimally invasive way.
So the advancement here is essentially doing the same surgery that we have in the past in a much more minimally invasive fashion, and that allows, rather than a large craniotomy, which could be blood loss and complication, exposing the entire brain during surgery, to now allowing us to perform a more accurate and efficient process, frankly, with a much more minimally invasive fashion with small incisions, tiny little holes. We're talking about a couple of millimeters in the skull that allow us to place these same electrodes deep in the brain to help our patients during the procedure.
Hello, my name is Stephanie. I've been seizure-free for almost 3 years now. I've been struggling with seizures since I was 8 years old. I've always been looking for an answer, and then finally my mom was searching in the internet and found Dr. Zakaria. Hi, Dr. Zakaria.
Hey, how are you?
Good, how are you?
Great.
Thoroughly studied my case, and you gave me answers that no other doctor that I've seen in my years of life given me, like, that I knew that I was born with this, and you were the only one who made the full effort to give me my answer that I needed. Thank you. Hi, Dr. Damasi.
Hi, Stephanie.
Did my brain look like any different than other brains out there?
During the surgery?
Yes.
Definitely, you had a unique brain. Most of it looked totally normal, but that area that was causing the seizures was certainly a little bit different in terms of the color, the way that it felt. It was a little more rubbery, a little harder. So we could certainly tell that there was a difference between the normal brain and the disease part of the brain. Now that you've been free for seizures for 3 years almost now, and you've been able to come off a lot of your medications, what have you been doing with your wonderful brain?
After brain surgery and recovery, I decided I want to do something very significant and work with children one-to-one. So I became a registered behavioral tech, and I help children on the spectrum with decreasing or increasing their socially significant behaviors, independent functional skills, and just increasing a lot of things that make them better in life, basically, set them up for success. Thank you, Dr. Zakaria, for everything that you've done for me.
It's my pleasure, Stephanie.
You have really changed my life, and one day when I do have a family, I will bring them and show you.
Thank you so much. It's so good to see you. I'm so happy for you, and it was my pleasure to help you.